So a couple weeks ago, I released Dr. Eric Berg, Worst of the Healthcare Industry, where I exposed Eric Berg as a fraud and a charlatan. He's not a doctor, he only has a chiropractic degree, and he has absolutely no ability to read and understand any of the research he refers to.
I'm still trying to figure out what it means because it's very complex and confusing.
And Eric Berg ended up watching my video, and of course he was upset by it, but you'd think Eric, being a doctor with all of his vast knowledge on health and nutrition, he would just simply make a counter video refuting my arguments and the evidence I provided. But no, instead he just made up a series of lies and ad hominem attacks against me, because he has absolutely no way of refuting my arguments against him.
I think first thing I want to say is, like, it's amazing that you interviewed that vegan guy. I don't know how the heck that you got through that, because I was like just cringing. The guy is literally insane.
So this all happened during an interview Eric Berg published to his channel a few days ago titled Dr. Berg and Frank Tufano on the Carnivore Diet. For those of you who don't know Frank Tufano, he runs a great beauty and makeup channel. I highly recommend you go check it out if you're into fashion or makeup or anything like that. Frank actually sells his own brand of eyeshadow and lipstick that doesn't rub off.
I don't see any makeup. Do you guys see any makeup?
And what's especially strange about this incident is the context. Eric Berg brought Frank Tufano onto his channel to discuss the carnivore diet, but for the first few minutes, out of nowhere, for seemingly no reason, they just started complaining about me.
Hey guys, so we have a special guest today. Frank Tufano is here, and I'm really happy to interview him. He's done a lot of personal and also work with the carnivore diet, as well as coaching other people. So I wanted just to talk to someone who's done it for a while and kind of go through some questions. And I think first thing I want to say is, like, it's amazing that you interviewed that vegan guy. I don't know how the heck that you got through that, because I was like just cringing. The guy is literally insane.
So a few things to address here. First of all, I don't think you have the academic credentials to declare whether or not someone is mentally insane. You know, on account of you're not a fucking doctor. Maybe you should add that into your legal disclaimer. You already mentioned that you're not a doctor, but I think you should also add that you are not qualified to give psychiatric assessments and that you should always consult a licensed psychiatrist for a proper assessment of mental health. And as it turns out, I did just that. A year ago, I was involved in a court case where my mental health was brought into question, so I got a psychiatric assessment to prove that I'm mentally sane. The doctor who conducted the assessment was Dr. Julian Goger, a licensed psychiatrist, and this assessment was done at the Manassa Clinic in Toronto. The diagnosis and prognosis was that there is no evidence that I suffer from any mental illnesses, including schizophrenia, and that I am of no threat to myself or others, and I pose no risk to the public. So here's some advice, Eric. Maybe you should refrain from giving any kind of medical advice or diagnoses on account of the fact that you're not a fucking doctor and you don't have the slightest clue of what you're talking about. And apparently, the Virginia Board of Medicine also agrees with me that you don't have a fucking clue of what you're talking about, because they reprimanded you and fined you $1,500 for what is essentially medical malpractice. The Virginia Board of Medicine conducted an investigation against Eric Berg and found he was guilty of numerous violations where he utilized techniques in the care, diagnosis, assessment, and treatment of his patients that fall outside the scope of the practice of chiropractic and do not constitute acceptable standards of chiropractic care and have no reasonable scientific or medical research, investigation, study, or data to support their efficacy or therapeutic benefit. Despite the lack of reasonable scientific or medical evidence to support the efficacy or therapeutic benefit of BRT or NAET, Dr. Berg repeatedly advertised or represented to patients and the public, either implicitly implicitly or expressively that BRT and or NAET were techniques that could be used to prevent, alleviate, diagnose, assess, treat, or otherwise ameliorate a variety of conditions and symptoms, to include but not limited to the following: allergies, thyroid problems, infertility, depression, migraines, fibromyalgia, PMS, blood sugar problems, arthritis, sciatica, prostate problems, skin-related symptoms, heartbeat problems, and stubborn metabolism. So basically, Eric Berg was caught lying to his patients, where he claimed that the tests and treatments he was performing could be used to diagnose and treat numerous illnesses, even though there is no evidence that these treatments work. And as far as I can tell, he knew full well that what he was doing was illegal. He just cared more about the money he was making rather than the well-being of his patients, which is pretty fucked up, especially considering that some of the illnesses mentioned are life-threatening. So Eric was convincing these people to pay for treatments that don't work, and this could have ended up killing them. This investigation also turned up other violations, where he did not have signed consent forms for treatment, he failed to take adequate medical histories and perform adequate physical examinations for patients, and he did not properly manage patient records. So overall, he just ran a shoddy business. And on multiple occasions, Eric was also caught calling himself a doctor without clarifying that he is a chiropractor. So again, this guy was just trying to mislead patients into thinking he's a medical professional. So Eric, again, here's some more helpful advice. Maybe you shouldn't sling mud at people and call them crazy when there's already quite a lot of dirt on you. And sure, I've said a lot of controversial things over the last few years I've been on YouTube, but it turns out I'm not crazy, and I'm also not guilty of medical malpractice, so there's that. And why does Eric Berg have such a problem with me? Why is he willing to make up lies about me and call me crazy? What was so insane about my criticisms against him?
Okay, so now check this out. Here's a graph of the Framingham study, which basically all of the risk factors that you get on your cholesterol reports are based on this one study. And if you've ever read the study, it's fascinating. A lot of doctors have never read the study. But this is what it says. It says that when you have lower cholesterol, and by the way, on the left side here, these are the deaths, yearly deaths, 1, 2, 3, 4, and 5, okay? And that's with people with low cholesterol, and then people with high cholesterol. They're considering 270 high, 130 low, okay? So this is what happens. If you look at the deaths with low cholesterol, it's 1 out of 1,000 at 130, and it's 2 out of 1,000 at 270, okay? So this is what they did. They said that's an increase of 100% risk. But notice what they said. They used the word risk, but not rate of getting heart attacks. Risk has basically no legal definition, apparently, in this study, because it's not really a 100% increase, because these are fractions. If you know anything about mathematics, going from 1/1000 to a 2/1000 is only an increase of an actual 0.1%. 1/10 of 1%. That's the real rate of getting a heart attack. If the doctor told you that you have a 0.1% of getting a heart attack, you probably wouldn't take the medication because it's so rare. 1/10 of 1%. Okay, that does not make sense. So, so that's basically how they fudged it. They used the risk factors, and you say you're at 100% at risk, and they have risk 1, 2, like a risk factors of 1, 2, 3, and 4, which I'm still trying to figure out what it means because it's very complex and confusing.
So there are multiple problems with what he just said. First of all, that graph he's referring to isn't from the Framingham study, it's from the Multiple Risk Factor Intervention, or MRFIT, screening follow-up study. I think he just copied this graph that someone made in a blog post without realizing his mistake, so he clearly never read the Framingham study himself.
I'm still trying to figure out what it means because it's very complex and confusing.
Secondly, Eric Berg is also misrepresenting the MR-FIT data, and I think we can assume he didn't read this study either. According to the MR-FIT primary screening study, those in the highest cholesterol quintile had 3.42 times the risk of dying from heart disease compared to those in the lowest quintile. And if you look at the actual data set that Eric Berg is referring to in his graph, cardiovascular disease death rate for those in the lowest cholesterol group was just under 6 per 1,000 people, and those with a cholesterol range between 260 to 279 had a cardiovascular disease death rate of just under 15 people per 1,000. So those numbers he wrote down on his whiteboard don't make any sense. They're not from any data set found in either the Framingham or the MR-FIT screening studies. I don't know exactly where he would have gotten those numbers from. I'm pretty sure he just made them up. Or he used Google, found a graph online that was from a blog, and he just roughly copied the graph and those numbers onto his whiteboard without knowing where that graph actually came from and doing any of the actual research on his own. Wow, look how crazy I am. I must be completely fucking out of my mind. I explained in a calm and rational manner that you don't know what you're talking about, and the research you are actually referring to directly contradicts your claims that serum cholesterol is not a significant risk factor for heart disease. So this is what insanity looks like to you. I think it's pretty clear that you don't actually think I'm insane. You just have no ability to refute my arguments against you, so you're resorting to personal attacks against my character rather than attempting to attack my arguments. And if that's not evidence that you're a fraud and a charlatan, then I don't know what is. Now, if you watch this video, Eric Berg is very clearly referring to me when he calls me crazy, but he never actually addresses me by name. And I'm assuming that's because not only does he not want his fans and followers to discover my content and watch the videos I made criticizing him, but I think it's also pretty clear that he has no interest in debating me, and he knows he would lose miserably. But, you know, I'm perfectly open to debating you, Eric. I'd love to have a health debate with you. We can discuss what actually causes some of our most common chronic diseases like heart disease, diabetes, cancer, and what foods and diets are best for treating or preventing these diseases. I'm not afraid of you. I know the person you really are. And if you want to keep pretending to be a doctor, then maybe you should actually stand up to people like me and have a debate, rather than just hiding in your little corner of the internet, making ad hominem attacks against me, while also being too afraid to even mention me by name, you cowardly fraud. And if you like this video, maybe consider supporting me on Patreon. I have some funding perks you may find interesting. If you're looking for clothing, then check out the Vegan Gains store. Also, be sure to subscribe to my gaming and live streaming channel, Vegan Gains Live. I stream every single night, and the streams start between 8 and 10 p.m. Eastern Time, US and Canada. And be sure to follow me on Twitter to stay up to date with my streaming schedule. And as always, keep making those vegan gains.
What a relief. When will this poisonous product cease? This is another public service announcement. You can believe it or you can doubt it. Let us begin now with the cow. The way it gets to your plate and how.